Seth Fenton is a former NUH patient who in July 2024 was admitted to intensive care at Queen's Medical Centre due to hyponatremia, critically low sodium, which nearly took his life. He says that each one of the doctors, nurses and care staff that looked after him during his time in QMC were exceptional and ultimately saved his life. Turns out Seth has Addison's disease, which is now something he has to manage through medication for the rest of his life. As someone who had to relearn straightforward tasks, including walking, it's also incredible that a year later, Seth took part in the Outlaw Sprint Triathlon here in Nottingham to raise money for the Nottingham Hospitals Charity as his way of giving back. But better still, Seth is here on the podcast to say thank you to all of those exceptional staff. Seth Fenton, welcome to Don't Say the Q Word.
Thanks for having me.
Your story, my word, take us back to that Wednesday back in July 2024.
I just had a sore throat. That was about where it started. I was off work, and by the Friday I was thrown up. It was not very pleasant, couldn't do really much. I was also in the middle of buying a new house, so I got the notification of that on the Friday, couldn't really go and celebrate. And then overnight, I just woke up in it. I was sweating, very confused, didn't really know where I was, felt a bit hungover, even though I hadn't been drinking. And I didn't realise it, but I started slurring my words and things like that. And my wife obviously raised a bit of concern and just said, we need to get on the phone to 111. We called 111. They were really helpful. And they did some tests with me. Obviously, I couldn't speak properly. So
No, well, they were worried because they couldn't actually understand what you were
saying. They couldn't understand a word I was saying.
Yeah.
So they were obviously asking all those basic questions, your date of birth, what day it was, all those sorts of things. And I thought in my head I was saying exactly what I should be saying, but it turns out I wasn't. So they then decided to send an ambulance to me, and that arrived within about 15 minutes. It was really quick. They were very relaxed, didn't seem to be too concerned, gave me some fluids and brought me in here, and that was kind of where it all started. It wasn't very well on the way here, lots more vomiting and lovely, nice things like that. But I was seen really quickly, blood tests and all that sort of thing. Was just waiting. They were more concerned about my airway and my throat and my voice and that sort of thing than the actual confusion. Because as soon as I had the IV in, I kind of perked up a little bit. I was able to walk to the ambulance and they brought me in. But then from the blood tests, they basically said you need to get to resus because all your numbers are dropping really quickly.
Because you came into NE,
Yep.
And they did blood tests.
Yeah, as soon as I got here,
which is
straight away.
Kind of standard.
Yeah.
You then were seen by ENT, weren't you?
ENT,
because of your throat.
It was more about my throat. That was the main focus. Once they'd taken the bloods, it was all about my throat and my breathing and that sort of thing, because that's what I've been off work with. That's where it all started. So that was the concern. They were just they would check me over, and I was just waiting in one of the corridors basically to be taken up to ENT on the ward, and then the nurses came back and said, we need to get you into resus because of your blood results and the numbers have come back. So then I was taken in, and it just, from there, I just went back to where I was couldn't speak again within probably half an hour.
So the deterioration was pretty quick?
Really quick, yeah. I mean, that was from between the times of 7:30 in the morning, I was really poorly about 9:30, and that all happened within those kind of 2 hours when I was in resus. But again, waiting in resus, they came and put a camera down my nose to check my throat again, but I got worse and worse and worse. Suddenly started not being able to use my hands, so I couldn't open my phone, and I started not being able to swallow. So really, really lovely picture. I was dribbling because I couldn't swallow, but then I couldn't pick up any tissues to wipe my mouth because my hands had stopped working. But I knew everything that was going on. I can remember it all. When everyone was asking me questions, I was in my head, like I was doing with the paramedics and on the phone to 111. I was answering the questions in my head, but then as I was trying to speak them, nothing came out. It was very much like I was a bit numb in my mouth, and that which wouldn't work, so nothing would work. So
did you feel, you felt like you were having a stroke or?
Yeah, so I thought ultimately I thought I was having a stroke, and it had not been mentioned, but I think that's what had been said from 111, all the signs and symptoms, apart from a few of them, but they were like, well, you've lost your speech. So that's what I was concerned about. And I'd had a friend that had a stroke a few years before, and automatically went that way. I was like, right, well, I can't speak, I'm dribbling, this is it. I have to kind of plan in my head what was going to happen next. I know I can survive it. But yeah, that wasn't mentioned in resus. It was just like with kind of not what was going on, but we didn't have to treat it, probably didn't really know what was going to happen to me next. So, but it just got to the point where I couldn't even communicate that I needed to go to the toilet. I couldn't do anything. So I know a bit of Makaton from one of my old jobs, so I tried to start using Makaton to communicate, but then no one around me understood what I was saying, so they were trying to guess. So now, yeah, it was really difficult to be. It was almost like trapped in syndrome, I guess.
Well, I was going to say, because that must have been terrifying. You're aware of what's happening, but you can't actually vocalise it. You can't. You can't move anything. Nothing. I mean, that must be terrifying.
Yeah, it's really weird. It was, because I didn't know what I was doing, but I think because I was so poorly, I didn't realise at the time, I couldn't really compute how ill I was and how bad it was. So, and I'm not trying to sound brave or anything like that, but I wasn't that scared at the time because I'm in the right place. I'm with the right people. You know, my wife's there, the doctors are all here, they're doing what they should be doing. They aren't panicking. You know, the lead doctor, Dan, he was so calm and so relaxed and so honest with me about what was going on that I didn't feel worried. I was a bit like, what's going to happen next? The only thing I thought of was, I don't want to die. I've got a little boy, well, I didn't have a boy on the way, but I've got a little baby on the way. I just need to survive. I don't want to leave my wife as a widow and a single parent, so I just need to stay with it all. Yeah,
we hadn't mentioned by this point that your wife was 10 weeks pregnant?
Yeah, from a long, very, very long journey of IVF. So we've been 7 years trying for a baby.
Wow.
It was our last go, it was the last one, so it was really important that she stayed fit and healthy and was quite stress-free, which obviously didn't happen because I was now in hospital. So yeah, she was 10 weeks pregnant, trying to look after me, look after herself, and stay quite calm and things like that. But it did help that with the doctors and nurses around us it wasn't like it was panicking that you see in the movies or anything like that. It wasn't like that. It was very calm. They were all very relaxed. They communicated everything to us really honestly, and yeah, so we knew what was going on. As much as they knew, as much as they knew what was going on, we knew what was going on. But like I say, it felt like a trapped in syndrome because I just couldn't communicate at all. Couldn't even open my phone to type on it because I couldn't use my hands either. So,
wow.
Yeah.
Shh, don't say the Q word. So this Dr. Dan.
Yeah.
And we're determined to find out which Dan this is. In a trust that's over 19,000 staff.
Yeah, sorry, I didn't get his surname.
Bit of a needle in a haystack.
Yeah.
But Dan will know who he is and will be listening.
Hopefully.
Tell me a bit about Dan, because you say about how calm he was, but actually he gave you the option, didn't he? Do you want the truth?
Yeah, he pretty much said. I think my wife wasn't there at the time. I don't know where she'd gone. She went to the toilet or make a phone call or something. But he basically came to me and he was just like, do you want me to just be honest? And I was trying to do thumbs up or thumbs down, things like that. And he goes, you just need to stay awake. That's all. You know, you're really quite poorly. If you stay awake, if you don't stay awake, you'll slip into unconscious, and we don't know what will happen after that. It will be quite serious. We've got everything here that we need to try and keep you with us, and you're in the right place. But just stay awake. That's all I need you to do. And he was like, do you understand? And I was like, yeah, let's go.
But what is going through your head? He's basically said, if you don't stay awake, you could die.
Yeah, I mean, I think I was just in a different mode at that point. I didn't really, all I heard was stay awake. I don't think I kind of processed the rest of it. I don't think I really took in, it was just, you need to stay awake. And I've learned since that at one point he was rattling the end of the bed to keep me awake, to keep me with him, because you're fighting your own body. Like what I've learned subsequently is that because of the low sodium, my nervous system went into shutdown, my brain had swelled, so I'd have CT scans and all this sort of stuff. And because of all that, my body was just in shutdown. It just couldn't cope with the lack of sodium in my body. Like there was nothing there. It was critically low. So my whole body is fighting just to go into shutdown mode, but I needed to stay awake. So you almost have this like internal battle to stay like conscious, but your body's just fighting. That's why everything was kind of not working, because it was trying to focus on my main organs to keep me kind of ticking over. So it was like this battle to stay awake. But the problem was that you can't, like a blood transfusion, you put as much in as you possibly can, whereas with sodium, you've got to bring it up really steadily and really, really slowly, otherwise it goes the other way. So you get too much in the bloodstream. So it's not a quick process, and there's still that chance for you to deteriorate in the meantime. And obviously at this point, they didn't know what was causing it either, so they could keep raising it and it could drop again. So it was like, we know how to fix you, but we don't know what the lasting damage will be. That's why the CT scans, because they didn't know if there was going to be any brain damage there or lasting damage. All that sort of stuff. Like I said, at this point, I couldn't walk, couldn't use my arms and legs, couldn't speak, I couldn't swallow. So it was all, yeah.
And you've had the honesty from Dr. Dan.
Yep.
which you asked for.
I did, yep.
But at the same time, you don't realise what's being said to your wife at this point, which is...
if my family are local, you need to call them to come in and prepare for the worst, to potentially say goodbye, because we don't know what happened next. So my wife's, again, at 10 weeks pregnant, is being told to go and phone my parents who live around the corner, and to come in if they can, because they knew I was in hospital. They didn't know how bad it was until the phone call was made by my wife to say, look, you need to get in and see him, because it could be the last time. So. And
your dad couldn't?
Dad didn't want to come in. He's got a thing about hospitals. I think he's a typical kind of man. He's lost his parents, things like that, so he doesn't want to get involved, and probably didn't want to see me in the state I was in, which is kind of glad, because I wasn't particularly, I was still in my pyjamas, not feeling great, not looking great, so he probably didn't want to see me like that. We've not really had a conversation about it since, but I just know he didn't want to come in and see me at that point, or couldn't, so my mum was the one that came in to see me.
And you knew the minute you saw her?
Yeah, again, all the way through, everyone around me was really chilled, including my wife, and she was just very much like, you'll be fine, you're okay, we'll get through this. Really calm, amazing in a crisis. The second my mum walked into that kind of bay in resus, I could see in her eyes that it wasn't good.
So you then go to ICU.
Yeah. So
and there's a couple of members of staff, and I know there's a much wider team than this, but there are two that stand out. So obviously one is Dr. Dan.
Yes. Yeah.
And the other one is the nurse patients.
Yes.
Who unfortunately is on leave today, because I would have loved to get the two of you together. Again, but again, she will be listening to this. So tell me and obviously your memories are a bit kind of here and there, but what do you remember of patients? Why does she stand out in all this?
Well, look, I kept getting worse and worse and worse, and when they took me out, so there's loads of doctors around. There was another French doctor who put my A-line in and stuff like that, so there was loads around. But I remember going up to ICU and being changed into my gown and stuff, and then put into my bay. And ICU is not a pleasant place to be in. I think while I was there, 3 other people passed away. It's noisy, it's all the monitors, and it's really not very pleasant. Obviously, you're not feeling very great yourself anyway. But she was just so reassuring, and and I know this is obviously what they do day in, day out, but she just sat at the end of my bed for 24 hours. That was her job, was to sit there, and she had to help me go to the toilet. She had to check on my monitors. The second I moved and it beeped, she was there. I was never ever left alone. And even when she went on a break, she got somebody in to come and sit with me as well, someone else. So it was just, but she, again, really calm presence, really softly spoken, just a great bedside manner, so reassuring of my family, to the point where I think the day after, I moved up on the Saturday, I think, and the day after, when I was getting a bit better, my cousin and his son, his little boy, came in to visit me, and he's only about 7 at the time, but he was adamantly wanted to come and see me. But the patients made sure that they brought him in a different door, so he didn't have to walk through the whole of ICU and see the other people. So it's even that attentiveness. And when people came to visit me, she was talking to them and updated them, but without just talking to them. She knew I was there and I was listening, even though I couldn't communicate very well. She still explained it to me as well as them. It was just the little things that just make it, you're in a really scary place. I've never been in ICU before. I've never really been in A&E before, or had an overnight stay in hospital. So to do that from 0 to ICU, where you've got all these noises and people crying because they and wailing and what's going on, to have someone that is that calm and that focused on you and that dedicated is just really relaxing and really calming. And yours in safe hands. I still couldn't communicate very well. It was coming back, and I thought I was communicating better than what I was, apparently. But it's still, she learned my cues as well, which was really impressive. She knew when I needed to go to the toilet, or if I needed a drink, and again, very honest, if I was thirsty, she's like, you can't have a drink because you're not allowed X amount of water per hour or whatever it was, because of all the balances within my sodium and things like that. So she was like, I know you're really thirsty, but you can't have it, and this is why. And kind of kept reassuring me that everyone's doing the right thing. So, yeah, and also I was hallucinating overnight, and I had some weird dreams, and I thought she was someone from a TV show, and I was like, what are you doing here? And she was like, a work, and you just kind of went with it. It was just like...
Was she someone cool from a TV show?
Maybe it's going to sound really sad. It was someone from Grey's Anatomy, the hospital thing, and I was like, what are you doing here? And it was just... And that was like the first. I had a couple of nights where I was hallucinating and I had weird stuff, and all the doctors and nurses dealt with it really, really well. I think I got out of bed in high dependency and tried to get into another bed on the ward, and it was just like they all dealt with it so well. But she just took it and was like, just again really reassuring, went with it and was like, I'm supposed to be here, I'm looking after you, don't worry, you're in a safe place. And it was just like everything was really reassuring. And I think that was the key takeaway, was that everyone was calm, everyone knew what they were doing, they spoke to me as a patient, which I think when you can't communicate must be really difficult because you're not getting anything back. Instead of just talking to my family or friends that came to visit, they spoke to me as well. And just, yeah, they just knew what they were doing, like that level of calm and honesty, which I think is really, really vital when you're not very well. Especially for me, I just need to know what's going on. I don't want to be left completely in the dark. I want to know what I need to do to get better as well. I think within the critical care department, you're seeing people at their worst. You're not seeing them necessarily recover back to normal, or that kind of, you don't get the good story at the end. You just see people at their worst, and yet those nurses and doctors turn up every day to do that. They come in and they see people in really bad states and still stay positive, still try and reassure them. And that was the main thing. They still have a good laugh. Like all the nurses in high dependency were incredible. They were so good to be around. Again, really reassuring, really kind of supportive of the journey you have to go on. They really wanted to get me out of there, so they were trying their best to, to help me along on all that sort of stuff. So yeah, it was exceptional. That was all I can say. It was all exceptional.
Don't say the Q word. When you're ready. Okay. So, as we started this conversation, we mentioned that you have been diagnosed with Addison's disease.
I have, yes.
Which you have to manage for the rest of your life on medication.
Yep, artificially kept alive by steroids is the tagline. So, yeah, that's it for the rest of my life.
So, Addison's disease, for those who don't know what it is, or maybe have heard of it but really don't understand it, can you explain in a nutshell how that impacts you, what it means? Yeah,
essentially, my white blood cells attacked my adrenal glands for whatever reason. They decided they wanted to do that and have destroyed them, so they don't produce any cortisol. And yes, everyone thinks that cortisol is a stress hormone, but actually it's really important for you. It keeps everything ticking over, keeps your nervous system going, keeps your sodium levels ticking over, which ultimately keep all your kind of main organs going and your immune system. And cortisol is released when you're stressed to help manage that, and when you are poorly to fight off your illnesses. My body doesn't produce that or another little hormone called aldosterone, which is the other one that does your sodium levels. So I can't produce them anymore. So they are both critical to life. So in order to keep me alive and keep my body functioning, I need to take medication 3 times a day in order to kind of stay alive. And that's what dropped my sodium, and that's what made me so poorly in the first place, was probably a long-term drop of all those levels, and the sodium and the cortisol and the aldosterone, and then it accumulated in that kind of what's called an adrenal crisis, which is what actually happened to me on that day. And to avoid that, I take the medication every day. Certain times when you'd have natural spikes of your cortisol, I have to carry my emergency medication with me, which is an injection in case I do have another crisis. But it's just about managing the medication mainly, avoiding stressful situations, maybe updosing my medication when I'm poorly, so anything more than a cough or cold, so avoiding that, because it's classed as an autoimmune disease, so just be really cautious, which is great with a 1-year-old, because obviously he is lovely and sharing everything he possibly can catch. So it's trying to do that, all that sort of stuff. Obviously heavy exercise as well, so anything that puts undue stress on your body, your body would naturally release some more cortisol. So anything that would kind of put any extra pressure on your body, whether it's physical or mental, emotional, I have to updose.
Hang on, a year later, or less than a year later,
10 months,
you did the sprint triathlon. You're just telling me you're not supposed to overexert yourself?
Not necessarily not overexert, but just take precautionary measures when I do it. So on that day, I double dosed everything to make sure I could get through. And then if I didn't finish, I'd blame it on the Addisons.
What would Dr. Dan be saying now?
I have no idea.
He didn't listen to me.
No, it was again another driving force to recovery. I think, like, my friend said she wanted to do it, and I was like, oh yeah, absolutely, I'll get into it, because I set myself a recovery kind of process, walking to the shops of this day, and everything was slow going. I had brain fog, confusion, my words were all muddled for a bit, my legs weren't working properly. So getting back to all that, and then when I started feeling better, I was like, I need a bit of a challenge to get me moving again. So my friend said, I'm going to do the sprint triathlon, which it isn't a full triathlon, it is just a short distance one. I was like, yeah, absolutely, I'll do it with you and we'll see how we get on. And I thought, a bigger challenge is to do it for a charity, because then I can't drop out. Basically, I can't turn my back on it because I'm raising money. And then I set the page, and the donations went up and up and up, and I was like, I definitely cannot step back now. So my goal was just to finish, not in a time, but just to complete it. Even if I was the last one across the line, 10 months after that, you know, being admitted to intensive care, I thought it was pretty good going. So I did it in under 2 hours, and I'm happy with it.
Amazing.
Yeah. So
and you raised money for the Nottingham Hospitals Charity.
Yeah, about £1,400, I think, in the end.
Incredible.
Which is, I mean, that's a massive thank you to everyone that donated. That was not me. I just had to stand on the day and do a bit of swimming, a bit of running, a bit of cycling. But it was everybody that put the money in to support me was what got me across the line. So yeah, it's really good. Yes.
Seth.
Yeah.
It's been a pleasure.
Thank you.
How great you're sitting here. You must
Yeah.
think that every day.
Yeah.
I'm still here.
Yeah, absolutely. When days get tough, you just think, I may not have been here. When work's hard, or you're tired, or you know, you're having a bit of a grumpy time, you just got to appreciate it, really. Appreciate the quiet as well, because sometimes, yeah, I may not have been here, and I'm just really grateful for all that. And I think my wife probably is, and hopefully my son will be one day. Hopefully one day grateful that I'm here still. So, but I'm not annoying him too much. But yeah, it's all good.
No, it's your right as a parent to be annoying. Absolutely. Embarrassing.
Yes,
the word.
absolutely.
So finally then, Seth, I know you've kind of said it already, but I would like you to say it to the staff of NUH, all the staff, the huge team who would have been involved in that whole traumatic journey for you. Yeah. The floor is yours. The podcast is yours. What do you want to say to them?
Just a massive thank you. Thank you for turning up every day and doing what you do for everybody that comes through these doors. You've made a massive difference in my life, and I'm sure in hundreds of other people's lives. So keep doing it. You're amazing people, and it takes something really special to do what you do. So yeah, just thank you very much.
And you can do our final sign-off.
Yeah, thanks very much for having me. I'm Seth Fenton, and don't say the Q word.